Hey everyone, welcome to STEMageer, your source for expanding your imagination and learning all about STEM-related topics. If you'd like to watch more of my content on STEMageer, click the subscribe button and the notification bell so you never miss a new STEMageer video. If you also like this video, drop a like down below. So now on to today's topic, public health and epidemiology. Right now, more than ever, the STEM field of public health is really important. You may ask, why is that? As we all know, we are dealing with the COVID-19 pandemic and it's affecting so many people worldwide. In today's STEMageer adventure, I will interview Dr. Tamarra James-Todd, who's an assistant professor of epidemiology at the Harvard T.H. Chan School of Public Health and a researcher. She will help us learn more about public health, what epidemiology is, and why it is important. So let's get started. Hello, Dr. Tamarra, and welcome to STEMageer. I really appreciate the time you took out of your day to be here. To kick this off, could you tell our viewers about the field of public health? Because a lot of kids don't know what public health actually is.
Sure. So first of all, thank you for having me, Alonso. I'm excited that you're doing this really important work. So people have probably been hearing a lot about public health lately. And so public health is a discipline that ensures that we take care of the health and well-being of the population. So we don't just, like doctors, treat one person at a time. People who are in public health think about the health of the entire population, and it could be large groups of people in a country, or it could be as small as some people living in a town, or even people that are attending schools like you attend, because you're in middle school, right?
Yeah.
Yeah, so we have to think about different ways in which we can take care of people. That includes thinking about how diseases are spread, like COVID that's going on right now. It also includes things like behaviors, like how we eat, nutrition, and the environment. Are there environmental factors like air pollution that can make people sick? We also think about things that affect moms and babies, or dads and babies. And so it's about group health, population health.
Interesting. So you're an epidemiologist. That's a really big word. A lot of kids may not understand what that means. Can you tell me what an epidemiologist does?
Sure. So when I used to tell people that I was an epidemiologist, the first thing that people would say is, "Oh my goodness, you study skin." I was like, no, I don't study skin. And so you probably already noticed there's a word embedded in epidemiology, or epidemiologist. Do you know what that word is?
I actually don't, but I don't see it yet.
So can you see it? Can we dissect that word? Epidemiology. So ology means the study of.
Yeah.
So the first part of that word, the first part of epidemiology actually comes from the same root as epidemic. And we're experiencing a really large epidemic right now. So what is an epidemic?
An epidemic is a disease that is spreading quickly among a group of people.
Yeah, so we look at the distribution and the patterns of disease and their causes. That's what we're interested in. So we do think about things like the spread of disease. And when we have something that's spreading a lot, like around the whole world, we call that a pandemic. But that's what epidemiologists do. They use math, and they use biology and the understanding of pathology and the human body to understand how people become sick as a population. And how does disease spread, and what are the different patterns? Because some people, like COVID right now, are more likely to get really sick from COVID compared to other people. So we want to understand what that is so that we can reduce the risk. So epidemiologists look at the pattern and the distribution of disease and try to understand the causes and the things that protect us from getting diseases.
If any of our viewers want to study public health or become an epidemiologist, how would they do that? What subjects are important as kids to pay attention to? Like, what kind of degrees do you need?
That's a great question, Alonso. So a lot of kids who might be interested in this field may be interested in, thinking about the human body. So learning more about science and biology and understanding how diseases affect the body, maybe through pathology or the environment. So you definitely need to go on to college and take a lot of science classes, but you also need to take a lot of math classes. You have to be really good at math. And one of the types of math that we use all the time is statistics. We understand risk and try to understand the odds of getting disease and things like that. You often also, after college, have to go on and get a master's degree. So you might go to the School of Public Health and get a master's of public health. And that helps you to kind of better understand how to kind of practice some of these things in the real world. And then for some of us, we go on after getting a master's degree to get a doctoral degree. We get a PhD or a doctorate of science. And for that, we may study epidemiology specifically and learn how to design studies. And what studies are just experiments. Oftentimes as scientists, we do experiments. An epidemiologist does an experiment where they're really interested in learning, does eating good foods, making sure that you have enough vitamin C and vitamin D, do those things help improve your bones and your muscles? And so we might develop a study that allows us to see that. So when you get a PhD in that, we learn how to design studies.
Again, thank you for sharing and explaining more about your STEM-related career in public health. I learned a lot today, and I'm sure our viewers did too. Thank you for coming, and I'll see you next time. Bye.
Bye.
Thanks for joining me in the STEMageer adventure. Remember, if you liked this video, then click the like button down below. If you would like to see more STEMageer content, click the subscribe button. Thanks for watching, and I'll see you in the next video.